Hello, this is Lygia Ricciardi at the Digital Health Live Studio at CES 2019. I'm here speaking with Lynnette Cooke, who's the Global CEO at Kantar. Welcome. How are you,
Hello.
Lynnette?
I'm fine, thank you.
So, did you have a good time speaking earlier today on your panel here at CES?
I did, it was great. We had a very engaged conversation about patients and how we can improve health outcomes.
So let's talk about, we were chatting a little bit before about patient engagement and how that's changed over the last few years. What kind of trends are you seeing, and what does patient engagement mean to you?
Well, first of all, I'm excited that the term patient engagement is even coming up, because for many years drugs were being developed and medicine continued to advance without really even taking into consideration what was happening with the patient. So now more and more evidence needs to be generated before things will be approved or reimbursed. But for us, for Kantar, what we're trying to understand is, how do we engage the patient? How do we help to empower them so they understand more about their health care? And importantly, how do we reach them at the right time? Because everybody's in their journey as a health consumer. They're in a different journey, and the rest of their ecosystem will impact whether or not you'll take your medicine, how you're feeling about your health care. It's all interconnected.
So is the research that Kantar does primarily geared toward pharmaceutical manufacturers, or is it providers? Is it patients themselves? Who's your main audience?
So our main stakeholder...
Policymakers, perhaps?
Yeah.
Who knows?
In terms of the engagements that we do and the consulting that we do is mostly with the pharmaceutical companies.
Got it.
So we're helping to provide insights and evidence for them on what the physicians are interested in, what the payers will approve, and more as we were talking, what the patients are willing to take, and how much of their own health care they're willing to take into their own hands.
Are you seeing changes from a consumer or patient perspective in their idea of sort of ownership of their health, and whether that's a privilege or an overwhelming responsibility, or how people think about it?
Yeah. Well, so the answer is yes. There is more and more of an understanding of that as a health consumer, we can do something about it. We don't have to wait until we have some symptoms and then let the physician tell us what we need to take or not take. But it does vary. It varies greatly across the globe, and then also by age, in terms of interest in taking more responsibility for one's health.
What would you say, based on your research, is a primary age bracket in which people are most motivated or receptive to being engaged in their health?
Well, if I answer that through the lens of why we're here, and the panel that I spoke on, we talked a lot about the digital tools, and so the centennials are definitely, this is a part of their life, sharing information, sharing data. Some of their most personal information will come much easier than the baby boomers.
But they're also mostly fairly healthy.
They are, however, adapting the right behaviors now will help them to live longer and prevent them from maybe suffering from some of the chronic ailments that baby boomers are experiencing today.
Got it. Well, so I guess the future continues to evolve as people and technology both evolve. Thank you, Lynnette.
Thank you.
This is Lygia Ricciardi with Carium. I'm here at the Digital Health Live Summit, sponsored by Living in Digital Times.